Good morning, good afternoon, and good evening, everybody. Today is our final day of the gender data gap in startup ecosystem, where we have just begun to explore the gender data gap within the startup ecosystem. And today is this panel here is a very important one because this is where we're going to be starting to redefine or change the narrative on what FemTech means. Before we get started, I'd like to just say a little bit about the land that I'm standing on. I'm in Collingwood, which resides within the territory of the Saugeen Ojibwe Nation, which includes the Chippewas of Nawash, the unceded First Nations and Saugeen First Nation, and is home to many Indigenous people, including Haudenosaunee and the Anishinaabe. Welcome, ladies. I'm very excited, and I hope you are as well, because today we're actually going to start to redefine what FemTech means. FemTech should mean more than just menstrual health and sexual health. It's a combination of things that are designed specifically by women for women. We are anatomically different. We are biologically different. We are very different. Therefore, the things that are designed for us and around us should be different as well. In every single market, 50% is not considered niche. Yet 51% of the human population is considered niche. So thank you, ladies. I'm just going to go around and ask you to introduce yourselves. Rachel, can you introduce yourself, please?
Of course. Hello, Rachel Bartholomew, CEO and founder of High IV Health. And I am a two-time cancer fighter. I won't say survivor just yet. And I created my product out of my own personal, dealing with cancer.
And Karina.
Great. Thank you, Cindy, for having me here. My name is Karina Wali, and I'm based in India. I'm the founder of Saheli, which is a social enterprise that provides last mile linkages for rural women to low cost but high quality and evidence-based health products, which include menstrual hygiene products such as menstrual cups, sanitary napkins, but also anemia prevention products like fortified foods, sanitation devices, etc. So the idea is really to open up the rural poor women sort of market, which is highly neglected within India. Thank you.
And I apologize, I actually forgot to click record and I forgot to start the webinar. I'm going to start again. I apologize. Hello, good morning, good evening, and good afternoon. Welcome to the final day of the Gender Data Gap in the Startup Ecosystem, where we begin to explore what the gender data gap is within the startup ecosystem and begin to influence it. Today I'm joined, today I'm joined by a group of wonderful ladies who are helping to redefine what FemTech means. So FemTech traditionally is the sexual health and menstrual health. And we're going to be redefining what that means, as women are anatomically different, biologically different. Therefore, by design, we should be different. In no other market has 50% being considered niche. So why is 51% of the human population considered niche? I'm just going to pay tribute to the land that I'm standing on before we get going. Collingwood resides within the territory of the Saugeen Ojibwe Nation, which includes the Chippewas, the Nawash, the unceded First Nation, and Saugeen First Nation, and is home to many Indigenous people, including Haudenosaunee and the Anishinaabe. Welcome, ladies. Thank you so much. I apologize for that glitch at the beginning, so we're going to go around again. Rachel, can you please give us an introduction to yourself?
Of course, Cindy, thank you for having me. My name is Rachel Bartholomew. I am the CEO and founder of High IV Health. I'm a two-time cancer fighter, and I'm creating a device that helps conduct pelvic floor therapy remotely.
Needs-based, necessity is the mother of all invention. Karina.
Hi, everyone. Thanks, Cindy, for having me, and wonderful to hear, Rachel, about your product. My name is Karina Wali, and I'm based in India, and I'm the founder of Saheli, which is a social enterprise that improves rural women's access to health products, which are low cost, evidence-based, and highly effective. So this includes a whole line of products, starting with sanitary napkins and menstrual cups, but also anemia prevention products like fortified foods, sanitation devices where there's lack of toilets, etc. So the idea here is to open up the rural poor women market, which is highly neglected, and to have a social as well as health impact. Thank you.
And part of that battle, and I'm going to call it a battle, is accessibility. So thank you, Karina. And Mitzi.
Hi, thank you so much for having me with these incredible women. So I'm really happy to be here. I'm Mitzi Crockover. I'm an internist by training and previous practice. Helped to create the Iris Cantor UCLA Women's Health Center, and then went on to Humana as Vice President of Women's Health. And then decided I wanted to invest in women's health, so became managing director at Golden Seeds, which focuses on funding early stage women-led companies. And obviously my sweet spot is FemTech. And I also am the host of the podcast Beyond the Paper Gown.
Thank you so much. And thank you so much for being here. Bridget has been a bit of an inspiration to a lot of this. When I first started looking at having this panel, we actually started off originally as one panel on International Women's Day, and it seemed to unfold into these 14 different aspects of the startup ecosystem. And I talked to Bridget first with regards to FemTech, and she said, yes, I'll do the FemTech, but it has to be along the narrative of we are changing what FemTech means to being designed by women and for women. So Bridget, welcome. And please tell us a little bit about yourself.
Hi, everyone. I'm Bridget Mwambara. I'm a medical doctor and the founder of Vidal. So Vidal is a digital health application that enables women to identify their risk factors for cardiovascular disease and provides personalized care to enable them reduce these risk factors with the support of their loved ones, emphasize the word support of their loved ones, and enables them to monitor the changes in their health from anywhere and at any time. So I'm excited to be here to talk about FemTech as it relates to women and their health.
And it really does take a different entrepreneur to navigate the FemTech side of things, because in the ecosystem, anything FemTech is recognized as niche and stepping outside. And why do you need this when it's only for women? So I'd like to really kind of unfold your origin stories, how you actually followed the path to where you are now to be able to make the difference that you're making now. Rachel, we'll start with you.
Sure. So I'll try to make a very long story short. I was an entrepreneur before this with a company in actually the automotive software space, so very male dominated. I remember going to a sales show floor and no male would talk to me. They would always talk to my partner. And so I learned very quick that lens of gender, especially when it came to business. Again, popped up in this company, with investments and looking for investors, really just not understanding this space because they rightfully don't have the same anatomy. But that morphed into, going out working in incubators and that type of thing. I left the incubator, I exited my company, and 2 weeks later, I got my cervical cancer diagnosis. I had surgery. I connected with thousands of women on these Facebook groups who were screaming at the top of their lungs about the current standard of care, which I have right here, which is a static dilator, and unfortunately hasn't really been upgraded since 1938. And when I knew that that was going to be my demise as I headed into radiation therapy, I realized that I needed to do something and innovate on it. And I used my radiation treatments as a way to pitch to doctors. And they couldn't leave my side. So it was a perfect opportunity to have a doctor listen to me. And yeah, that's my origin story.
Thank you, and empowering. Thank you very much. And Karina. Your origin.
Great. Rachel, that was really, really inspiring, and it's very hard to follow that story. But basically, I am born and brought up in small town India, and I grew up inside a gynecology hospital. So my parents are gynecologists, and we live right over the hospital. But most of the patients that come into the hospital are from the rural poor background. So I really want to focus on the intersection of poverty, lack of access, and gender. And I think growing up in that environment and seeing how very affordable and evidence-based products could prevent major diseases. Very simple techniques could prevent uh, maternal mortality or anemia. Later down the line, could improve school enrollment rates. So really focusing on how simple interventions can improve the situation around me for so many women. For around 300 million women in India don't have access to toilets. And the sort of repercussion of that is that many of them drop out when they start menstruating. So there are so many sort of social determinants of health. And my focus, because of maybe where I was born or what I saw growing up, has been to increase that ambit of access to simple devices, affordable products and interventions that can go a long way in improving women's health. Thank you.
And I think this is probably a good time to introduce one of the pieces that really inspired me to pull these panels together. And it talks a little bit about Karina, about what you've put together, and also Rachel, what you've put together as well. And it's Invisible Women: Data Bias in a World Designed for Men by Carolyn Criado Perez. And creating these types of aha moments where we didn't know they existed are really what are propelling us forward to this change now. Mitzi, your origin story.
I have a couple of aha moments, and I'll try to compress them, but they're very related. Wearing my clinician hat, as you know, I started a primary care women's health center. Going to your point about it's not just GYN and reproductive health. There's so many things that impact on women's health, including everything from the research or lack of research, so that women, again, are not the 70-kilogram man that has been studied. So we were really behind in knowing what therapies, what treatments, or even what symptoms women come in with, as well as the issues that impact on our health, including, again, the research or lack thereof, but also policy and politics, as we are seeing, front and center, and as well as what we call social determinants of health, whether or not you can get access to good food, or, so any kind of socioeconomic issues, and even gender and racial bias. So that's one hat and one aha moment that as a clinician, I wanted to make sure that we factored in and understood, and also created educational opportunities for our medical students and residents. The second aha moment was fast forward, again, always trying to figure out how to really impact on women's health. And a few years ago, individuals, women came to me with their companies, such as Rachel, and not specifically Rachel, but entrepreneurs like Rachel, who asked me for my, clinical expertise. And it just dawned on me and showed me these are women with pain points. Again, Rachel's a great example, who couldn't find the answer, in the marketplace, and who were really creating the solutions. And that was my aha moment. This is how we are going to move women's health forward. And that's why I wanted to literally invest. And that's how I became an angel investor.
Thank you very much. And another book, and I cannot remember, I was just furiously trying to find it, Unwell Women. And we'll try to put that into the sideline there as well. There is so much being missed on health, even to the point of COVID. The research hasn't been done fully on the vaccines, on how it affects women. And we need to start unfolding and being part of that narrative immediately. And Bridget, what is your origin story?
Yeah, thanks, Cindy. And thanks for everyone that have spoken before me. So My origin story is not so different from Rachel's. So I grew up in a family where cardiovascular disease was a problem. So this is, I'm speaking from Nigeria, but one would think that infectious diseases were our main problem, but everywhere around me, people were being affected every day by hypertension, diabetes, and then they'll go on in their lives to experience the cardiovascular events. So at a very young age, I told myself that this is a narrative I really needed to change, and because it also affects me. So with a strong family history, it means that I had it staring at me in the face, only to grow up to realize that as I went through the various phases of my life, pregnancy, childbirth, and then lactation, breastfeeding, there wasn't many options for me as a woman. So the best option was basically to just prevent it. At pregnancy, there are little limited options for medications. And I just thought that there was something wrong with this. And we needed to change that narrative. As a medical doctor, I realized very quickly that the presentation was different among women for most cardiovascular events and even the onset, like stroke. So it got me thinking, and I had that aha moment to actually do something about it, which is to systematically start collecting stories and also to start collecting data and see how both the stories and the data I'm collecting could shape an intervention that could help us to actually make a product that can fit into women and the complex stages of their lives and improve their lives in the long run. So that's my origin story. Thank you.
Goodness, sorry, I lost the track there. And I love these stories, and these are, each one of these unique stories has created an aha moment just in this small bit of time that we've already done. And I want to start to unfold those aha moments in terms of when you first considered gender in a business decision. And I want to include and tell this story of audio equipment, because this is what we're kind of using right now to communicate with each other. And this equipment, this audio equipment, is not designed for us. It does not capture a female's voice. When it was first being designed, they had the option to be able to design for men and for women, and they ended up going down the track to capture the man's voice. So all of the microphones, all of the audio equipment that we're working with, the speakers, it's all been designed to capture and to amplify a man's voice. So what that ends up doing is it causes our voices to sound shrill or whiny. And how many times have we heard that? To the point where some of our strongest female leaders have actually gone and taken speech therapy to lower their voices and lower the cadence of their voices, or slow the cadence of their voices, to sound more like a leader at the podium. Prime example would be Margaret Thatcher or Hillary Clinton. So these are some of the aha moments, because out of necessity, we're needing to change how we're working, but there is that option to be able to build something out. So what is that first time? What is that first time that gender became an issue or became part of your business decision? Rachel.
Yeah, so I have two very quick examples. So the first is with my first company, being in automotive, being in a very male-dominated space, getting out on that show floor, trade show floor in Vegas, and going out and presenting my solution. And when I would present it, and pretty much every male would respond back, they would turn and respond to my partner, who was on the show floor with me. And so what I ended up doing was I was like, okay, well, I guess this is something I'm going to have to deal with to get business done. I actually trained my partner at the time to be my salesman. So I'm like, all right, it's time. You're not here for a joyride. It's time to become my salesman. And that's how I was able to get through that situation. Subsequently with High Ivy, this product that I'm showing, God bless the man who made it, but it was a man who made it. And that's partially why women don't have a very good pickup rate of this device. So, really trying to dig in and understand the ergonomics and the things and factors that impact how you create a product that better serves, a woman's anatomy. You'd think it'd be pretty straightforward, but I guess not.
And Karina.
Yeah, thanks, Cindy. I think there are sort of two sides to, or 2 points I want to cover here about when I first started thinking about gender in my business. So the first is really considering our HR policies, because our entire manufacturing team is comprised of rural women. And then our entire sales team is also, or the majority of our sales team is also comprised of women. So thinking really about very, very, very carefully about how to design policies, HR policies that are flexible enough to allow for childcare, to allow for the different responsibilities they have at home. When it comes to the manufacturing team, was really interesting and was not the norm in our context, because most of the manufacturing teams in local factories tended to be men. And then the second thing is, when our sales women go out into rural areas, they often have to commute on their bike for, let's say, 2 hours on a highway, and they come back a little bit closer to sunset. So thinking really, really carefully around safety in rural areas was extremely important. And then we changed around the timings a bit. We encouraged some women going into sort of areas that are slightly more unsafe to go by public transport instead of on their own. So that was extremely important. And these are, again, sort of social angles of considering gender in business. And then the second part is really selling to rural women actually requires rural saleswomen, and that's what we figured out through different experiments. So when it comes to, for example, selling a sanitary napkin, male salespeople were not as successful when we compared the data as compared to rural saleswomen with a little bit of training. So who the information is coming from is also extremely important when you're selling to women, especially when society or that culture is quite segregated. So that was the second aspect. And I think it's allowed us to actually provide employment to a lot more rural women and empower women in that way as well. So not just through the products, but also through employment.
And I think that you bring up a really interesting point that we didn't really consider. And I like to tell this story about how when I was 4 years old, I believed I could fly. And I would jump off of absolutely anything. I remember distinctly the feeling of the wind in my hands and the wind in my hair. And I left it. And I got to about 25 years of age and I went, oh, I didn't actually fly. But I had that wind in my hands again, and I had that sensation, but I needed that aha moment to go back and reflect on something that should never have been. And that's what we're unpackaging now. And one of the stories that really kind of hit me as funny is in the book, they talk about how in Sweden, they were saying, well, at least snowplow can't be found to be gender biased. And Karina, to your side, when you were talking about that 2-hour bike ride to get somewhere, they did actually find bias in how streets were plowed, because women stereotypically go from home, even as working women, go from home to drop off children at the daycare. If they do not have children, then they might go and visit an elderly relative or parent and then go to work. So there's that stop that goes differently, whereas men go from home to work. So the plowing service only did from the main area right to work. So you have all of these biases by infrastructure, by that's architected into things, including bathrooms. Women innately use more time in the need more time in the bathroom than men do. Yet the universal design is for men. A man can use any bathroom, but a woman can only use the ones designed for her. So interesting from that perspective. And Mitzi, from your perspective.
Sure. I don't want to make it too long. And so if we come back to it, because Bridget reminded me of, again, the issues with women, just from a clinical standpoint, the fact that, women don't have the same symptoms, for example. And I can give you a lot of different scenarios where their symptoms have been overlooked and they had something. And the issue is, I'll just point this out, that the challenge is not only, if the research isn't done, it doesn't get in the textbooks and journals, and it doesn't get into the doctor's offices. So the doctors may miss it. And then also, if women aren't educated, then they'll miss it as well. So I'll leave that for maybe a discussion later on. Wearing my investor hat, the issues, obviously with the gender gap is that we don't get, well, two things actually, or maybe at least two things. Number one is, and I'm sure everybody here will unfortunately perhaps relate, and that is we don't fund women to the extent that we need to. 4% of VC funding goes to women. That's, a drop in the bucket. And it's, even though there's organizations like Golden Seeds and things are getting better, it's not where it needs to be. But the other more nuanced issues perhaps are things that have been studied, like when a woman comes to present for funding. And what was very interesting to find out is that they're asked different questions or different types of questions than men are. Men are, again, somewhat of a generalization, as promotional questions. So when you scale, what is your plan? And it's more like for women, when you fail, what are you going to do? And but what's interesting, and here's what we can do, is that when a woman answers the promotional question that didn't get asked, they will do better than if they just answer the question from a funding standpoint, than if they just answer the question that they were asked. So, there's a little bit of information and perhaps help in terms of turning the table a little bit.
That is an amazing study by Jacqueline Kennedy. I consume her in so many different platforms. She also does a TED Talk. AWS was the first company actually brought that to my attention personally, but in practice, one of the things we've uncovered through all of these panels leading up to this is that same analogy works in life as well, because it's not just on the investment floor that we're getting these negative defeatist type questions, right? And the question that I think I see the most often is, that is an extremely saturated market. There's this competitor and this competitor and this competitor and this competitor. How are you going to be able to compete? And then they keep go on, because this has so much of this, and this company has so much of this. And it's so easy to stop them in their tracks and go, are you asking about my go-to-market strategy? There's two responses. There's no, and then they're not the right person for you because they really don't understand your market. And yes, and then you unfold this wonderful promotional, almost used car salesman response, right? Because you're empowered and you understand your toolkit. And that's one of the changes that we are going to be going about. I'm actually writing a book from this on getting into startup boards and advisory boards as women, and what that toolkit will look like. This is one of the books that I'm kind of using right now. It is Brad Feld and Mahendra Raman Singhani, an amazing book on startup boards. But understanding what your toolkits are right now will give you the ability to navigate these situations in a promotional way. Because again, it's not just on the investment floor, it's on every floor when we're talking to anybody. If we can present ourselves in confidence because we know why we are doing what we're doing, put that imposter syndrome aside, or at least navigate that imposter syndrome with going, no, I've got my skill set. I've got them written down. I know what they are, will make us kind of look at things a little bit differently. Bridget, from your standpoint, what was the first time that you actually considered gender in a business decision?
Yeah, thanks, Cindy. So I'll say I can't say the exact moment, but there's something that actually stands out to me all the time, and has always influenced my decisions, especially from a gender lens. And it's the fact that, yes, for women who choose to have children, they are there's that unique responsibility to birth life. But then there's then the assumed role that across all races and cultures in the world, that women are left with a caregiving role most of the time in most families. And this actually gives rise to like an unpaid work. So every time you find women who are juggling one caregiving role, either for their parents or their children, plus their careers, their studies. So at that point, it became something that I always have at the back of my mind whenever I meet a woman, that or whenever I'm designing a solution for women, that this is something that is going to be affecting the choices they make every day. It's going to affect their capacity to willingness to pay for items, and also their capacity to pay. So it's not surprising then that we have, when we look at the social determinants of health, with socioeconomic status standing out glaringly as one of the strongest determinants of health, that women, female-headed households, especially single mothers or any household that's headed by a lone woman, is worse off economically. So, and this has a lot of implications on their capacity to actually navigate various phases of their lives, and also affects their health ultimately. So it's one factor that I consider in making business decisions. And I mean, I could talk about this on and on, but yeah, I'll stop here for now.
And I think that's really important, is the lens that we're looking through. A lot of times, and I had this, I was given this revelation by Edith Lovato in the VCs and Angels panel. And she said, take your belief system and put it out in front of you as assumptions, because it gives you a very unique perspective that you hadn't thought of it in that lens before. So with that image of the lens, do you think that each one of us, firstly, will agree on what this gender data bias is, or what gender is even? And if not, what piece of that lens are we missing? What piece of that that lens can we add on to the perspectives that we have right now? Rachel.
That's a question that, oh goodness, I don't know how to answer it in the most holistic way. I don't believe we'll all have the same viewpoint, and partially just because we come from different worlds, and not to say none of them are right or wrong. I think it just comes from the experience that you go through. A couple examples. My area of health is very stigmatized, and even North America isn't quite up to par with pelvic health, let alone Asian countries, where often it's referenced as the tighter the better, but yet the pain and everything else that's associated with that is so significant. I think the one thing that we do have to consider, especially when it comes to FemTech and gender lenses, is the LGBTQ2 plus group as well. I have a lovely trans woman on my team who had went through the surgery, and the astronomical symptoms she goes through, and how much she gets forced and pushed out of the office, and how little she's considered in even the way that we conduct healthcare to the products that are given to her. It's very sad, and it needs to be more a part of the discussion, 100%.
And I just I wanted to bring up one statistic that that's actually dropped over COVID. Mitzi, you said that 4% of funding was going to only 4% was going towards investment in women. It's now dropped to 2%. So time to make change, and I think that that's a little bit scary as well. Karina, what part of the lens are we missing that you would be able to add from your perspective?
Yeah, thanks, Cindy. Just wanted to speak to what Rachel was also saying. So I think one huge aspect is the lack of representation of the LGBTQ community in FemTech or in any kind of, I think, health ecosystem in general. So not just sort of when we talk about FemTech, but around, I think, around the world, when it comes to health products or health services, this community is neglected. So that is number one. And number two, I think, is when we look at the global south, or when we look at communities or the population of the world that is living on less than $2 a day, there is a huge difference in the kind of access that I can have even living in India versus the access to health products and services, or any kind of intervention at all that a rural woman living on less than $2 a day can have in the same country. So I think we need to also think about how privileged we are as women who are sort of more well off, or women who have had the chance to be educated, and think of access as and add that access lens to whatever we're doing.
And I think that that's important to think about it from those terms of geography and access just by nature of where we're sitting, gender, culture, beliefs, and those play a big aspect to what our lens should be. And again, putting those beliefs out in front of us. Bridget, from your perspective, what part of the lens are we missing?
Yeah, so I think the lens that has always been missed, it's trying to, what you said from the beginning, the niche, missing out the 50%, not considering it niche. And this is something that has repeated itself a lot, especially in the medical profession, where women are excluded from interventions because of the various stages of their life. So I think it's important for interventions to start first by considering those unique phases that women go through. It's very complex, as we, from puberty down to adult age and to the climacteric phase. It's different for men and women, but somehow the focus is always more on the men, and they just exclude the women. Oh, it's not safe for them. So yes, even if we were to acknowledge that it's not safe, but then what do we do to fill that gap? And that brings me from the aha moments from yesterday, when we acknowledge that we should stop talking about the possibilities and actually start acting now. So from the very design stage, what should work, and that should inform the lens that we should see the medical interventions from, especially in FemTech, not just replicating those traditional roles that women are ascribed to. And more importantly, as we become more gender diverse, we begin to consider the LGBTQI. So it's important to have that lens from the very beginning.
And I because I've been using your story as a big part of the lenses that we're building out, Bridget, the aha moment that I've been talking about since the very beginning is the cardio heart, how a heart attack doesn't appear the same way in women as it does in men. And I use your example as a cardio health platform designed specifically for women of color, because race also plays a significant role in how we present with certain physiological aspects, right? And health issues. Cardio health is different in women of color than it is in other cultures or other races as well. So I wanted to just make sure that we added that that lens, because part of what we're trying to do is create a larger stage for all of us to be represented and to add to that little piece. So from Bridget, from your side of the lens, bringing in that LGBTI plus community, and Karina bringing in that rural side and women who don't necessarily have that large access, and then Bridget from your side being able to bring in the race side of that lens. And Mitzi, I left you for last this time because you tend to have a different lens, because you're looking at this as part of what you do on a regular basis. So what are we missing from that lens?
I think everyone here, touched on one piece of that or more. What I'll give you an example that impacted on me significantly as an example of, I think, what we're talking about. If you look at maternal mortality in the United States and infant mortality in the first year, United States rates at the bottom of developed countries. Yet we spend more per capita on healthcare than any other country in the world. And as we all know, it's not just zip code, which we've talked about in terms of access and all of that, but we do know that Black women suffer the most, and their numbers are the worst in terms of suffering from, again, complications of pregnancy and infant mortality. And when we look at the reasons for it, I don't think that we fully know the picture. Certainly, access to care is a significant piece of it, but even potentially epigenetic changes, and epigenetic changes that perhaps were also caused by trauma, stress, and racial bias, for example, as well as, implicit racial bias or even explicit. So, when we look at that as an example, that's the bad news. The good news, if you will, is that we have an opportunity to make changes, just as each one of these women here are looking through their lenses and identifying the problems. We have a long way to go, but for me, the take-home message is that most everything is multifactorial, and that we need to address it as such. So yes, we need innovation, but we also need policies that are supportive. We also need research, and we also need technology that will help us get some of those answers.
I'm going to go back to you again on this one. What does actionable change look like? And what right now, so leaving here right now, what does that actionable change look like? And what metrics can we put in place, or should we be putting in place, to ensure that that happens leaving here today?
Well, if I look at it again, wearing my investor's hat, we need, and as a, and focused on women's health, we just need more women in decision-making positions. I think we're seeing a lot more women in angel investing and early investing, and even maybe, again, increasing in VC. But at those highest levels, in those boardrooms or conference rooms where, again, everyone is pitching, we need more women to make those decisions and that have the purse strings. We need more women on boards to hold corporations and companies accountable. So you alluded to the fact that we needed, again, you're talking about startup boards, corporate boards, all boards. So you've got 50-50 women on boards. You've got NA, National Association of Corporate Directors, Women Business Leaders on Health, all have programs to, encourage women to be on boards and giving them the skills. So I think that's a real step in the right direction. And we need more women in biotech and STEM, because those are the individuals that are going to, again, if you look at it doesn't mean that men aren't going to do research on women's health, but certainly women are more likely to do so.
Now, one of the changes that we've kind of come out with a few of the different panels is that we need to make change at the government level to be able to affect change within all of these environments for women. So regulatory changes, policy changes, tax changes. So when a woman gets in as a female VC, to be able to lower those boundaries so that they're able to apply their money without having to rely on a spouse to be that individual. And we're looking at that lens from a number of different countries. And we have a few different countries represented here. And I'd love for that to be a takeaway. I'm helping to work on a few countries right now, and I hope that everybody takes that in, and let's be able to get that money, lower the regulations for research, lower the regulations for in taxes for women who are want to be into that angel and investment world, and take a look at what that looks like from our country's perspective, and create a template that we can then share with every other countries and be supportive. So it's something so subtle, but it'll make a massive difference and change. Rachel, from your perspective, what does actionable change look like from leaving this panel, and what should the metrics look like to follow that up, to push that forward?
It's a great question. I think part of that, Mitzi really hit on was, women in STEM and the research and the data that needs to happen. The more data we can get, the better we can understand these problems, and the better we can create solutions for them. And the more that we start to adopt that into the way that we conduct healthcare, conduct anything really, the better. And policy is another very big one. I mean, for us, it's in France, it's something, pelvic health is considered mandatory before having a baby, and after having a baby and recovering, and they're keeping women out of the healthcare system. Why we haven't adopted that, even though the proof is in the pudding and the data's there, comes down to policy, comes down to all of these things. And so, my action is to continue to push that narrative and get us in front of as many policymakers as possible. But it's a tough thing. It's very complex to push policy and government. But if you don't do it, nobody else is going to do it. So first steps at a time.
And perhaps what it takes is changing the narrative. One of the things that I've I think we've all kind of seen is trying to affect change from the corporate level. It needs to be monetized right away. Trying to affect change from the government level, it's very slow. And even if you get into the right people, chances are they're voted out before any real drastic change can be made. Standing strong and proud as women, well, we've seen in history books, well, none that have been written by men, but they're starting to be written now. We've seen how they end, and they don't end positively. By affecting change from the startup level, when companies are the most malleable, is the biggest change that we can do. So just influencing and being able to support either monetarily or just even men-led businesses to say, have you considered in the design of your product or service for women? Have you designed into your company people with different abilities, different races? And my daughter's actually brought me this picture. My youngest daughter brought me this picture one day, and she said, I finally understand the difference between equality and equity. And as a mom, I'm like, oh, okay, yes, that's wonderful. I can tell you the definition. And she showed me this picture, and it was an aha moment. It was these three equal boxes and a wall. And the man stood up on that box, and he was able to see over to the game, and it was wonderful. The woman stood up on the box, and the wall was too high. Even though it was an equal size, she was unable to see over. And the third box, the person in the wheelchair couldn't even get up on the box. So we do not want to talk about equality. Equality is simply a metric. We're trying to build in equity, and to build in that equity or diversely infused ideation, at the ideation stage, is really one of the biggest things that we need to do to affect change. From my standpoint, one of the, and we can actually build metrics into it, is we're starting May 3rd, we're starting a breakout room where companies can come and talk about their idea and understand what it means to design for women, for different races, for different abilities, and start to ideate and build that into the process of what they're doing. And if we start building these types of rooms everywhere, then change will be affected. Bridget, from your perspective, oh, I'm sorry, who am I missing now for I think it's Bridget, right? From actionable change and what the metrics look like.
Yeah, I think for me, the most important metric will be to see the proportion of funding that women get into their startups increasing. So having a situation where it's going from 4% to 2%, when there is a lot of momentum already building and there's a lot of voices talking about this, it's really, really discouraging. And it takes me back to what one of my mentors, a male mentor, actually said once as he was advising me in my career. He said, Bridget, be careful. Wherever you see so many voices, know that there'll be little action. Huh. So it's stuck. It's one of the things that has really stuck in as far back as that advice was given, it's really stuck in me. And I think that is something that we really have to change. So wherever there's a voice, there has to be an action. So that's I would say a kind of qualitative metrics that I would like to change. So as we talk more about this, there should also be tangible actions to make sure that women get access to the funding they need, especially to grow these women-focused companies.
And Karina, from you, and I think that that's an important point. I just want to unpack that a little tiny bit. Is the funding needs to be available, and it can't just be from female investors. It needs to. And we had an amazing panel yesterday with a couple of amazing women that have built out funds. So, and oddly enough, that was the very first panel to fill, and we had women at different stages of building out that fund, and that money needs to come from more than just women. It needs to come from all aspects of the investor side. One of the really interesting parts that was brought up yesterday was that on International Women's Day, a group of 7 men announced that they had a fund, and it's just what an inappropriate time to make an announcement of that caliber. Karina, from your standpoint, what does actionable change look like, and what should the metrics be to follow it?
Yeah, thanks, Cindy, and lovely to hear all of your answers. I think I'll answer this in 2 parts. One is within our organizations, because that's where I can actually implement any changes at this point, at least. So that I think for me, that is, really having women in decision-making positions. Having women in the designer position, having women in the leader position, the sales leader position. I think I really like this quote, you can't be what you can't see. So if we think of the long game, really, each of our institutions or each of our businesses can provide that inspiration to other girls in the community as well. So I think that is something I can implement through my organization. And at a societal level, there was a study done in India on the role or the effect of the gender quota that we have when it comes to elected representatives. So 30% of elected representatives need to be women at the local level. And when they looked at the impact of that, 10, 15 years down the line, there were, when you compared sort of wards with male representatives and wards with female representatives, women's health, women's education, women's economic opportunity had improved much more in wards that had elected female representatives. So I think we have to think of this as a long game, as sort of a multiple decade game, and a societal change needs to happen. And for that, not just startups, but as you said, funding and incubators, policy, all of it needs to come on board. I'm certainly happy to play my part.
And I think that's, oh, go ahead.
It's okay. If I could just interject, because I was reminded, because you talked about metrics. One metric that we need to keep in mind, but it's really interesting that it really hasn't made a difference in terms of funding, is that when you have women-led companies or a more diverse team, the company is more successful, the revenues are higher. That's a fact. And yet that hasn't moved the needle as much as one would think. So, just putting that out there.
And I think that's really important to kind of take a look at that. One of the books another book that inspired me is called Uterus is a Feature, Not a Bug, by Sarah Lacey. And it's an amazing book. And it talks about the bro culture. And I think that this is one of the things that we need to do as women is stop trying to be somebody that we're not, because it's so much easier to fight a battle when you're yourself than trying to fight a battle with the stereotype. My daughters were on the Young Entrepreneurs panel. And one of the things I learned from my youngest daughter is how she's growing up with a stereotype that's being enforced on her in school, that she has to dress a certain way, that she has to look a certain way, that she has to talk a certain way. And she was saying how tough it was for her to develop her own lens and to speak up for herself when so many people are coming down on her. So that's one of the biggest things that we need to do, is be strong in our convictions in who we are, put our beliefs out in front of them, in front of ourselves, so that we can take a look at them from the panel of assumptions. We take a look at the fact that having too many voices, so little gets done. So each single one of us has our own unique voice. So if we can use that unique voice to leave this panel today to affect change, can you imagine the impact that we can have from the countries that we represent? I'd like to thank you all for being here today. I think this was spectacular. Bridget, I'd love to hear from you. You're just about to say something.
Yeah, thanks, Cindy. Yes, so what you said about what your doctor's experience actually struck a chord, and I felt I needed to voice it out. So is the fact that sometimes we do have situations where women are adequately represented in the boardroom or in decision making, but the sad part of it is that they replicate the bias.
Yes.
So, and that's where they get to begin to tell other women, you need to dress in a certain way, you need to act in a certain way, your voice needs to be in a certain way. So I think it's also something we need to become very conscious of as women, to make sure that we don't replicate it. We need to stand out. Whatever standing out means for a woman, she needs to be very distinct. Thanks.
Yeah, and I think that's what right now. Who's the person that's doing it right now? And we'll just do this really quickly and go around. And I'd like to start with Rachel.
I am the biggest girl fan of her. Mitzi, you might know her. Cindy Gallup. She is the founder of Make Love Not Porn. Her motto is "Don't empower me, pay me." And she is brilliant. Every single person should follow her. I adore her.
Thank you. And Bridget, from your perspective, who is the person that's doing it right now?
Yeah, so I think these are women who are in the front line every day in their various careers, especially not because I'm in the health care space, but I have a lot of admiration for women who are nurses, doctors, especially during the COVID-19 pandemic. So these are women that have gone above and beyond to preserve lives. And I think those are the people that are getting it right at the moment.
Thank you. And Karina, who is the person that's doing it right now? And we just have a minute left.
Yeah. So very quickly, I don't know if you know about the Tata Group of companies, a huge conglomerate in India, and they've started this program for women who've had to take a break due to childbirth and childcare. So even if you have a 10-15 year break, they have a new program where they're welcoming women who've had to take that break and integrating them back into their huge companies. So it's a huge corporate player taking the stand, which is really admirable.
Oh, wonderful. And Mitzi, with the final word, who is the person doing it right? Oh, you're on mute.
It's actually a government, California, instituted that corporate boards had to have women on them. And so I think that that's a good start.
Amazing. I leave with this story. I was running after my friend because I lived right around the grade school from my house, and I was running after her. Hilda, 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 Hilda. I realized when I got up to her that it wasn't her, so I kept running around the corner and waving, Hilda, 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 Hilda. So I just want you women, thank you so much for this wonderful panel, and all the ladies out there, just keep running and waving. Thank you so much.